All right, let's plunge headfirst into this nursing situation in New Zealand.
Yeah, it's a real puzzle.
We've got these articles from NZLankaNews, and honestly, they paint such a mixed picture.
Hmm.
On one hand, the government's on this huge recruitment drive, bringing in nurses from overseas.
Right, right.
But then we hear about all these nurses here struggling to find any work.
Yeah, and that's what's so jarring.
It's like, are we short on nurses or not?
Well, one of the articles digs into the immigration policies around this, especially for healthcare workers.
Kind of the behind-the-scenes stuff, right?
Exactly. And that's where this green list comes in.
The green list.
Yeah, basically it's this fast track to residency for skilled workers that they want here.
Okay.
But get this, nurses weren't even on the list originally, back in early 2022.
Wait, seriously.
Hmm.
If they need nurses, wouldn't you make it easier for them to stay?
You'd think so, wouldn't you? It seems a bit backward.
Definitely.
I mean, they did eventually add nurses to the green list.
Right.
But it makes you wonder what they were thinking at first.
Yeah, talk about mixed messages.
Exactly.
And this whole disconnect, it's really highlighted in one nurse's story. Khushbu Sabharwal.
Oh, yeah.
She's from India, came to New Zealand, and now she can't find a job.
It's heartbreaking.
She even went public, said the government should stop recruiting if there aren't jobs available.
And you can understand her frustration, can't you?
Completely.
Hmm.
Imagine packing up your life, moving across the world for a better future,
Yeah.
and then landing here and there's nothing.
It's a tough situation.
So how's the government responding to all of this?
Well, they've acknowledged the concerns at least.
Okay.
And they're saying they'll review the immigration policies.
Sounds like they're starting to realize that maybe just bringing in tons of nurses isn't the solution.
Yeah, it's not as simple as that, is it?
Definitely not.
Mm.
And that brings us to the second piece of this whole puzzle,
Okay.
the whole issue of nurse supply and demand. It's like everyone's got a different piece of the story, but nobody has the whole picture.
Exactly.
Health NZ, they're saying they've hired more nurses than they budgeted for,
Right.
which makes it sound like we have a surplus.
Mhm.
But then the nurses organization, they're reporting unsafe staffing levels
Yeah.
and even talking about potential hiring freezes.
It's confusing, to say the least.
So which is it? Do we have too many nurses or not enough?
Well, it's not that straightforward, you see.
Right.
The healthcare system, it's not just about the total number of nurses.
Nope.
There could be regional differences, different areas needing specialized nurses.
That makes sense.
Budgets might be influencing things too.
Right, right.
It's way more complicated than just counting heads.
So we need to dig deeper, look at the nuances.
Absolutely.
And it's interesting. There's this Health NZ commissioner, Dr. Lester Levy.
Yes, I've heard of him.
He's actually saying their recruitment, both domestic and international, has been more successful than they thought. Yeah. So maybe it's not so much a shortage overall, but more about getting the right nurses to the right places.
Right. So maybe it's a distribution problem rather than a sheer numbers problem.
It could be. And then if we shift our focus to the experiences of these international nurses,
Things get even more concerning.
the article talks about hundreds of them,
Wow.
jobless, out of pocket after coming here to work.
It's really unsettling.
Many paid tons of money to these recruitment agencies, and now they're stuck.
It raises some serious ethical questions, you know?
About the whole recruitment process.
Yeah. I mean, is it right to lure people here with promises of jobs that might not even exist?
Exactly. It's like dangling a carrot that's not even there.
And then what about the responsibility of these agencies?
Yeah, what about them?
Are they accountable for this situation?
Big questions.
Big question.
And this whole situation, it's affecting New Zealand's reputation globally.
Oh, absolutely.
The article mentions that India and the Philippines, they're warning their citizens about coming here for nursing jobs.
Wow. That's significant.
Yeah, tell them to be careful unless they have a guaranteed job offer.
That's not good for New Zealand's image.
No, it's definitely a blow to our attractiveness for international talent.
For sure.
So we've got this tangled web of contradictions.
A lot to unpack.
We've got the recruitment drive, the conflicting stories about shortages, and the ethical issues with international nurses.
Right.
But before we get too lost in the weeds here, let's take a step back and look at how this is all playing out in the media and the public eye.
Okay, sounds good.
Let's put on our media critic hats for a moment and see how this nursing issue is being framed and how people are reacting.
All right, let's do it.
One thing that pops out right away is the strong language being used.
Like what?
Words like crisis, shortage, exploitation, they're everywhere.
Yeah, I've noticed that too.
And those words, they create a sense of urgency, you know?
Oh, absolutely.
It's hard to ignore them.
And then you have the personal stories from nurses themselves.
Right, the ones who are unemployed or facing really tough working conditions.
Those stories, they make it real for people.
Yeah, they put a face to the issue.
And it evokes this emotional response.
It's hard not to be moved by them.
No, for sure.
We're hearing from nurses who feel disillusioned, frustrated,
Yeah.
even betrayed by the system that brought them here.
It's powerful stuff.
And it's not just traditional media outlets covering this either.
No, not at all.
Social media is buzzing with it,
Absolutely.
like a digital echo chamber.
Right, everyone's talking about it.
You've got online forums, social media groups.
Mm-hmm.
They've become spaces where nurses can connect, share their experiences.
Yeah, and advocate for change.
It's digital activism, basically.
Exactly.
It's amazing to see how social media has given a voice to those who might not have been heard otherwise.
It's a powerful tool.
But with so much information and so many opinions flying around, it's easy to get swept away.
Oh,
Like trying to drink from a fire hose.
perfect analogy.
So it's crucial to take a step back. Look at the bigger picture.
Right.
Ask ourselves, what are the underlying causes here?
Yeah, what's at the root of all this? Well, for starters, New Zealand's healthcare system, like many others around the world,
Yeah.
it's facing a perfect storm of challenges.
Like what?
Well, you've got the aging population.
Right, more people needing health care.
Exactly. And then add budget constraints to the mix.
So the system is struggling to keep up with demand.
Exactly. It puts immense pressure on the entire healthcare ecosystem.
And makes workforce planning a nightmare, I bet.
You can say that again.
So it's not just about nurses. It's about the system's overall capacity.
Absolutely.
It's like trying to fit a square peg in a round hole.
Perfect analogy.
And then there's the global context too, right?
Oh, yeah, we can't forget that.
The demand for nurses is skyrocketing everywhere,
It's a global talent war out there.
which means New Zealand's not just dealing with internal pressures,
Hmm.
but also external forces.
Makes it even tougher.
Yeah, it's like trying to play a game where the rules constantly change.
Exactly.
So we've established that this is complex, lots of moving parts.
Definitely.
But what about solutions? What needs to happen to untangle this mess?
Well, there's no magic bullet, unfortunately.
Right.
But there are a few ideas being tossed around.
Like
One of the most common ones is increasing funding for healthcare,
more money.
more resources, more support.
Okay, makes sense.
It could lead to better salaries for nurses,
Right.
increased staffing levels, better working conditions.
Like giving the system a much-needed boost.
Exactly. But it's not just about throwing money at the problem either.
Right.
We need to make sure the funding is used strategically.
So target the root causes, not just the symptoms.
Precisely. And another important piece is streamlining the immigration process.
Make it easier for nurses to come and work here.
Exactly. The current system, it can be quite bureaucratic. It can deter people who want to work here.
So cut through the red tape.
Exactly.
And that could make New Zealand more attractive, especially with all this global competition.
For sure. And it's not just about getting them here either.
Right.
We need to support them once they arrive.
Okay.
Help them integrate into the system, make them feel valued.
So providing resources, support, helping them settle in,
Absolutely.
things like language training, cultural orientation,
All of that. Mentorship opportunities as well.
creating a welcoming environment for everyone.
Exactly. Both domestic and international nurses.
Sounds like creating that supportive environment is key.
It is.
Making nurses feel valued, appreciated,
Definitely.
not just like cogs in a machine.
Exactly. We can't forget about the ethical recruitment practices either.
Right, those international nurses who were brought here with false promises.
We can't sweep that under the rug.
Absolutely not. It's a serious issue
It tarnishes New Zealand's reputation.
and highlights the need for more transparency, more accountability.
For sure. In the recruitment process, especially.
Nurses need to know their rights, have access to support if things go wrong.
Absolutely.
It's about building a system based on fairness, integrity.
Exactly. And ultimately, I think one of the most important things is collaboration.
What do you mean by that?
Everyone needs to work together to find solutions.
Okay.
The government, healthcare providers, nursing organizations, and most importantly, the nurses themselves.
So everyone has a voice,
Exactly.
everyone working together, sharing perspective.
That's the only way we're going to find solutions that work for everyone.
Because ultimately it's about people's lives, right?
Yes,
The quality of healthcare in New Zealand.
exactly.
Well, we've certainly covered a lot of ground in this first part of our deep dive.
A lot to think about.
We've explored the complexities, the contradictions,
Right.
but we've only just scratched the surface.
There's so much more to explore.
And that's what we'll be doing in the next part of our deep dive.
Looking forward to it.
we'll be shifting our focus to the potential consequences of this nursing situation on the healthcare system itself.
Okay.
What are the ripple effects? How could this impact patients and the care they receive?
Big questions.
Big questions indeed.
We've talked about recruitment, the whole back and forth about nurse shortages, and the ethical side of bringing in nurses from overseas.
Yeah, lots to unpack.
So now let's think about the impact all of this could have on the healthcare system as a whole.
Okay, the ripple effect.
Right?
How could this nursing situation affect patients and the care they get?
Well, one thing that comes to mind straight away is wait times.
For treatment.
Yeah, if hospitals and clinics don't have enough staff, it's going to take longer to see patients.
That makes sense.
And that means delays in diagnosis, delays in treatment.
And those delays, they could have a domino effect, right?
Exactly. It's not just about inconvenience, it's about potential knock-on effects.
So it's not just about waiting longer. It's about things potentially getting worse because of those delays.
Precisely.
Conditions could worsen, leading to even more complex and expensive care down the line.
Exactly. It's like a backlog building up, putting even more strain on resources and staff.
And all of that pressure, it can lead to burnout among healthcare workers.
Oh, absolutely. Nurses are already working incredibly hard,
Yeah.
and understaffing just makes it so much worse.
We've all heard stories of nurses being stretched thin, working long hours, feeling the pressure.
It's a huge problem.
And burnout can lead to more nurses leaving the profession altogether.
Exactly. Which just makes the shortage even worse.
It's a vicious cycle.
It is a downward spiral.
So we've got potential short-term consequences like longer wait times and burnout.
Right.
But what about the long term? What could happen if this situation continues?
Well, one big concern is the impact on New Zealand's healthcare system's reputation.
Okay.
If it starts to look like New Zealand can't provide good care,
Or support its healthcare workers.
exactly, it could discourage skilled professionals from coming here.
So it's not just about getting through this current situation, it's about the future.
Exactly. We need to make sure New Zealand remains an attractive place for healthcare workers.
Otherwise, attracting and retaining talent will become even harder.
Exactly. And if we don't address these issues,
Yeah.
it could even erode public trust in the healthcare system.
Oh, right. People need to feel confident that they'll get the care they need.
Exactly. And if that trust is broken, it's very hard to rebuild.
So we've got this web of interconnected issues.
Right. With potential consequences, that could be pretty far-reaching.
It's all connected.
It is.
But remember, these are potential consequences, not guaranteed outcomes.
Right.
By acknowledging the challenges and taking action,
Yeah.
New Zealand can find its way through this and build a stronger system.
Absolutely. It's not too late to course correct.
So, solutions.
Mhm.
We've talked about increasing funding and streamlined immigration.
Right.
What else can be done to address these potential consequences?
Well, one thing that I think deserves more attention is preventative healthcare.
Preventative healthcare.
Yeah. Instead of just reacting to health problems after they arise,
Okay.
why not try to prevent them in the first place?
So shift the focus from treatment to prevention.
Exactly.
Interesting. How would that work?
Well, it's about prioritizing things that keep people healthy.
Okay.
So promoting healthy lifestyles, early disease detection, community health programs.
So stop the problem before it even starts.
Exactly. By doing that, we can reduce the burden on the healthcare system overall
It makes sense.
and create a healthier population.
A win-win.
Exactly. And we shouldn't forget about technology either.
Oh, right. Technology is playing a bigger and bigger role in healthcare.
It is.
How can we use that to our advantage?
Well, we can use it to improve efficiency, make care more accessible,
Okay.
especially for people in remote areas who might have trouble getting to a doctor.
So things like telemedicine, remote monitoring.
Using technology to bridge those gaps. Precisely. Technology has the potential to revolutionize healthcare.
Right.
We can use it to reach more people and deliver care more effectively.
It's exciting to think about the possibilities.
It is.
But we can't forget about the human element in all of this.
No, of course not.
How do we ensure that nurses' voices are heard throughout all of this?
That's essential.
They're the ones on the front lines experiencing these challenges firsthand.
We need to create platforms for them to share their perspectives, their concerns, their ideas.
Okay.
Give them a seat at the table where decisions are being made.
So open forums, surveys, direct engagement with policymakers.
All of that. Opportunities for nurses to be part of committees and working groups that are shaping healthcare policy.
So they're not just told what to do, they're actually involved in finding solutions.
Exactly. It's about fostering a culture of collaboration and respect.
Where nurses feel empowered to contribute.
Absolutely. Their voices need to be heard, not just acknowledged.
Because at the end of the day, they're the ones most affected by these policies.
Yes, they see the real-world
You've
consequences.
covered a lot of ground.
We have.
The complexities, potential consequences, possible solutions.
Right.
It's clear that this nursing situation is multifaceted. No easy answers.
Definitely not.
But by acknowledging the challenges, exploring solutions, and prioritizing the well-being of nurses, we can work towards a better future for healthcare in New Zealand.
Absolutely. It's a collective effort.
It requires vision, collaboration, and putting people at the center.
Well said.
As we wrap up this part of our deep dive,
Yeah.
it's important to remember that this issue is constantly evolving. Things can change quickly, new challenges can emerge.
Right.
So we need to stay informed, stay engaged, and keep having these conversations.
Absolutely. It's an ongoing dialogue.
And in the final part of our deep dives,
Yes.
we'll be looking ahead, exploring the steps New Zealand can take to build a more sustainable and resilient healthcare workforce.
Sounds good.
It's about anticipating challenges and preparing for the future. All right, welcome back for the final part of our deep dive into nursing in New Zealand.
The home stretch.
We've really gone through the current situation, the potential problems,
Right.
and now it's time to look ahead, think about the future.
Okay.
What can New Zealand do to build a healthcare workforce that's not just getting by, but thriving?
That's the goal. Right.
Exactly. A workforce that's ready for whatever comes next.
And while there's no easy answer, there are definitely some key areas New Zealand could focus on.
All right, let's hear them. Where do we even start?
Well, I think a crucial starting point is investing in the future of nursing, literally.
Investing. What do you mean?
We need to strengthen education and training programs for nurses, make sure they're well-funded, have the latest technology.
Right, make sure those programs are top-notch.
Exactly. And staffed by experienced educators who can train the next generation of nurses.
So it's about setting those future nurses up for success.
Absolutely. Give them the knowledge and skills they need to navigate the complexities of healthcare.
And it's not just about that initial training, right?
Yeah.
They need to keep learning throughout their careers.
Oh, for sure. Continuing education is crucial, staying up to date with the latest advancement.
So investing in their professional development.
Exactly. Specialized training, mentorship programs, maybe even financial help to pursue further education.
Creating a culture of lifelong learning for nurses.
Yes, that's the idea. And by investing in them, we're not only improving the quality of care, we're showing them we value them.
That their growth matters.
Exactly.
But all of this sounds great in theory. How do we actually make it happen?
Well, it requires a team effort. Everyone needs to work together.
Okay.
The government needs to prioritize healthcare funding, make sure resources are there for nursing education and development.
Right. Put their money where their mouth is.
Exactly. Educational institutions need to work closely with healthcare providers to make sure what they're teaching is relevant.
So it aligns with what's needed in the field.
Yes, exactly. And nursing organizations need to be strong advocates for nurses, pushing for policies that support them.
So everyone working together like a well-oiled machine.
Exactly. We need a shared vision, a shared understanding that investing in nurses is investing in the health of the whole country.
Because a strong nursing workforce means a strong healthcare system.
Precisely.
So we've talked about education and training, but what about the day-to-day reality of being a nurse?
Wait, that's important too.
How can we improve working conditions, make the profession more attractive?
Well, we have to address the big issues. Staffing shortages, heavy workloads, concerns about safety.
Yeah, those are real problems that can't be ignored.
Exactly. We need to create environments where nurses feel supported, respected, and valued.
Because if we want to keep the nurses we have and attract new ones, those things are essential.
Absolutely. By improving working conditions, we can reduce burnout, increase job satisfaction.
And hopefully stop nurses from leaving the profession.
Exactly. It's about making nursing a job where people feel good about coming to work.
So things like safe staffing ratios, opportunities for growth, a positive work culture.
All of that. Teamwork, collaboration, open communication, those are all important.
And it's not just about the practical things, right? It's also about recognizing the incredibly important work that nurses do.
You're absolutely right. We need to show our appreciation, celebrate their achievements, give them opportunities for leadership.
So empower them, give them a voice in shaping the future of healthcare.
Exactly. Recognize that they're not just care providers, but partners in improving the system.
Because their insights and experiences are invaluable.
Absolutely. We need to make sure their perspectives are heard and considered when making decisions.
So moving away from a top-down approach to something more collaborative.
Yes, where nurses are active participants in shaping their profession.
Okay, we've covered education, working conditions, empowerment. Anything else that's key to a thriving nursing workforce?
Well, we can't forget about diversity and inclusion.
Right, making sure everyone feels welcome and respected.
Exactly. We need to actively recruit nurses from all backgrounds, create a workplace where everyone feels valued.
Because a diverse workforce is a stronger workforce.
Absolutely. Different perspectives, different experiences, different skills, that all benefits patients and the quality of care.
And it makes the healthcare system more representative of the community it serves.
Exactly. It's about fostering a sense of belonging, where everyone can bring their whole selves to work.
This has been quite a journey exploring the world of nursing in New Zealand.
It has.
We've uncovered challenges, talked about potential consequences, and looked at ways to create a better future.
A lot to think about.
It's a complex issue, but it's one we need to address.
Absolutely.
And as we wrap up, I want to leave our listeners with this thought.
Okay.
This isn't just an issue for politicians or healthcare leaders.
Mm.
It affects all of us.
Right, it does.
The health of our country depends on a strong healthcare system. And a strong healthcare system depends on a strong nursing workforce.
It's all interconnected.
So we all have a role to play in supporting nurses and advocating for a better system.
Absolutely.
Thank you for joining us on this deep dive into nursing in New Zealand.
It's been a pleasure.
We hope you've gained a better understanding of the challenges and the opportunities.
And the vital role nurses play.
Remember, this is an ongoing conversation.
It is.
Stay informed, stay engaged, and let's all work together to build a healthier future for New Zealand.
A future where nurses are valued and empowered to provide the best possible care.
Until next time, keep diving deep.